We would like to acknowledge the ancestors, elders, and families of the Wurundjeri and Woiwurrung peoples of the Kulin Nation, who are the traditional owners and custodians of university land. As we share our own knowledge practices within the university, may we pay respect to the deep knowledge embedded within the Aboriginal community and their ownership of country. Please be advised that this video discusses traumatic historical experiences of Aboriginal and Torres Strait Islander peoples and sensitive topics. Viewer discretion is advised.
Smoking is a major health issue in Australia. Cigarettes contain multiple dangerous chemicals. Tobacco smoke alone contains more than 70 known carcinogens, which are cancer-causing chemicals. Some of these include tar, carbon monoxide, elements like arsenic, beryllium, cadmium, chromium, cobalt, lead, and nickel, which can all cause cancer. They even contain radioactive compounds. Smoking affects multiple organs in the body, including the lungs, brain, the heart and circulatory system, the mouth, and even sexual organs. It can cause many chronic illnesses such as chronic obstructive pulmonary disease, emphysema, chronic bronchitis, lung cancer, decreased lung function, increased risk of infection, and damage to the airways and alveoli. It further increases the risk of getting over 15 different types of cancer. Aboriginal and Torres Strait Islander peoples are 2.9 times more likely to be a current smoker compared to non-Indigenous Australians. Within the Indigenous community, 2/5 of the cancer burden, or 39%, and the cardiovascular disease burden, also 39%, and the respiratory disease burden, 42%, were attributed to smoking. Although smoking rates within Indigenous communities have dropped, with a 7% drop from 48% to 41% between 2002 and 2019, smoking rates in Indigenous Australians are much higher than non-Indigenous Australians. While studies indicate that vaping is less harmful than smoking due to the reduced number of harmful chemicals, it still carries major health risks. Vaping use is extremely high in the Indigenous community, with 1 in 3, or 31%, reporting that they have used a vape at least once in their lifetime. Research shows that youths who vape but have never smoked have an increased likelihood to take up tobacco smoking compared to youths who have never vaped.
So, how did smoking become such a big health issue for Aboriginal and Torres Strait Islander peoples? Australia's nicotine history began with nicotine-containing plants, otherwise known as bush tobacco. While some Indigenous peoples chewed these plants before the invasion of British settlers, tobacco didn't become the problem that it is today until British settlers began trading tobacco with groups of Indigenous Australians. This, as well as the abundance of abuse that colonisers forced upon these peoples, has directly led to a high prevalence of tobacco use and addiction compared to non-Indigenous peoples. From 1788, European colonisers introduced British tobacco across Australia. As it's an addictive substance, Aboriginal and Torres Strait Islander peoples began to seek tobacco out. Colonisers exploited this fact and used tobacco to exploit labour, goods and services from Indigenous peoples. Tobacco was also included in ration packs, the meagre food supplies given to Aboriginal and Torres Strait Islander peoples after taking their land and livelihood from them into 1940 and until 1968 on some cattle farms. The addictive nature of nicotine led to not only dependence on tobacco, but also on the ration packs it was distributed in. So why is tobacco use still an issue for Indigenous peoples? Well, trauma is strongly linked to substance use, including the use of tobacco. It also causes poorer social, emotional well-being, which are also associated with higher tobacco use. Historically, the removal of Indigenous peoples from their land, culture, and families, as well as contemporary removal of children and high rates of incarceration, which mean that Aboriginal and Torres Strait Islander peoples experience a disproportionate burden of poor mental health, social health, and emotional well-being and trauma. increasing the use of these negative coping mechanisms. As a result of the intergenerational trauma resulting from the stolen generation and systematic racism, many Indigenous peoples have difficulty finding or maintaining employment. Unemployment and low income are key risk factors for smoking, which with individuals in the lower SES category being 3.3 times more likely to take up smoking within their lifetime compared to people in high SES groups.
When it comes to bringing health initiatives to Indigenous communities, there are things that make the initiative successful and things that should be avoided. What doesn't work? Initiatives controlled by the government with little or no input from Indigenous peoples often fail to achieve the health outcomes they've created to improve. Without input from people in these communities, organisations cannot assess what needs to be addressed the most or the best way to address it. It can lead to cultural insensitive or inappropriate outcomes and do more harm than good. It must also be addressed that the Australian government has been responsible for events such as the stolen generations, which have caused Indigenous peoples great harm and intergenerational trauma. As a result, programs run by the government may be perceived as unsafe and untrustworthy. Things that do work. Putting Indigenous health in Indigenous hands. Studies have shown that Aboriginal controlled health services are 23% better at attracting and retaining Aboriginal clients than mainstream providers. Through local engagement and more accessible delivery models, cultural safety is improved and self-determination can be achieved. Additionally, having the appropriate resources with easily accessible translations into the languages spoken in communities involved greatly improves engagement. Programs delivered in English without translation or interpretation into local languages can be inaccessible. Even when English is spoken, varying levels of health literacy can impede understanding and engagement. By improving communication, positive changes in health status are more likely to occur. Next, using a holistic approach to healthcare. It is vital that programs be based on Aboriginal and Torres Strait Islander ways of knowing and doing. This includes viewing health as holistic and addressing the social determinants of health. By utilising strategies that have been in place for tens of thousands of years, a more meaningful impact is had, rather than trying to force communities to adopt a Western approach to health, which is often lacking in support outside of physical health and well-being.
The Koori Ways program, Flip the Vape, is an Indigenous-led program co-designed and facilitated by multiple ACHOs across Victoria. It's funded by the National Tackling Indigenous Smoking Program, another great Indigenous-led anti-smoking campaign. It's partnered with Aboriginal Quitline and managed through VARS. The program is aimed at Indigenous youths and advertises about the risks of vaping and encourages quitting. Their website features information about the impacts of vaping on the body. It also shares shocking statistics, like 37% of all First Nations deaths are caused by smoking, and 22% of Aboriginal and Torres Strait Islander people aged 15 plus have tried a vape. Their site also links to info pages from Aboriginal Quitline about the benefits of quitting vaping, the cost of smoking, the effects of vaping on your body, and tips for creating a vape quitting plan. Their campaign also features young Indigenous leaders from across Victoria with images of them flipping the bird, hence the name Flip the Vape. It's funny. The program acknowledges that old fear-mongering methods aren't working on younger generations, and so this program focuses on empowering Indigenous youths to take control of their futures.